Well, there's some innovative strategies for veterans with diabetes. In the VA, well, it's on the cutting edge of research. Dr. David Aron is Director, Clinical Program Research and Education at the Cleveland VA Medical Center, the Department of Veteran Affairs. He's with us today to discuss the exciting advances in VA research on the topic of diabetes research and all the new scientific discoveries from within the VA, as well as the multitude of research that takes place at VA medical centers across the country. Welcome, Dr. Aron.
Thank you very much. It's a privilege to be here.
Well, these research results and advances greatly impact the treatment and prevention of diabetes and disabilities, not only for veterans, but all Americans.
People usually don't think about research and VA in the same breath, but in fact, the VA has been involved in research for 90 years and has done some incredible things along the way that have really had major impacts on healthcare at large. I've been privileged to be a physician in the VA for 40 years and do research for 40 years. Much of it related to diabetes, and my particular interests are about providing care more effectively, putting into practice what we know works.
Mm-hmm.
There are other people who try to figure out better ways than what we have now, better drugs, for example. So the whole spectrum of research is done in the VA, from basic science through clinical trials, through health services research. It's really an exciting place to be, and I've been able to see lots of changes over the years.
Sure sounds like it. I mean, VA researchers are studying innovative strategies along with the technologies, including group visits, I believe, telemedicine, peer counseling, internet-based education and case management, all to enhance access to diabetes care and to improve outcomes for patients. I mean, what else are VA researchers working on, Doc?
So it's a wide variety of things. Close to me here at the Cleveland VA, we have two technology centers. One is called Advanced Platform Technology, develops devices that helps people with disabilities to help them do their activities of daily living. Then there's a Functional Electrical Stimulation Center, which uses electric pulses to make paralyzed limbs work. And I've actually seen a person with a spinal cord injury who could not walk, confined to a wheelchair, hooked up to one of these things, and walk down the hall.
That's amazing.
Now,
that's great news.
This is not, prime time for, that it's going to be available to everybody tomorrow.
No.
But, research comes in steps.
Yeah, well, it's just unlucky what time you're born, right, Doc?
That's right. That's right.
This is the thing. Now, you're treating diabetes as one thing and ways to prevent it. But in special populations that you're talking about, elderly, amputees, minorities, spinal cord injured patients, and those with kidney and heart disease too, apparently. Now, this disease affects nearly 25% of VA's patient population. That's the leading cause of blindness, end-stage renal disease, and amputation. I mean, thank God you're working on the stuff you're doing because, it's pretty serious, isn't
it? It's extremely serious. It has major implications, economic implications, for society as a whole, not to mention for the individual person who has the disease, where, having diabetes puts a real burden on somebody.
Well,
and we have to help them. We have to enable people to deal with that.
Yes, that is true. I grew up in a family where my grandmother had diabetes and lost a leg through it all, amputated. It's not a good thing. Nearly 30 million Americans have diabetes, according to the CDC, and 84 million more Americans are at risk to develop the disease. So when it all boils down, Dr. VA's research breakthroughs They'd not be possible without the veterans who have volunteered to participate in VA studies. That's true as well, isn't it?
Absolutely correct. Absolutely correct. And we really appreciate that. You know, it has nothing to do with one's benefits, and it has everything to do with one's being a citizen.
My word. Well, that's good. The VA, highly recognizes, November as being the American Diabetes Month and is thankful to all veterans. Now, from a layman's point of view, what are early symptoms of diabetes?
Sure. The typical early symptoms relate to an elevated blood sugar level, which causes increase in urination, particularly urinating at night, and increased thirst. Blurred vision related to changes in the shape of the lens, related to changes in the blood sugar level, sometimes dizziness, sometimes weight loss. But many of the symptoms are really quite insidious and or mild enough that people don't realize that they have diabetes and can come in after complications have already developed. I've even seen one individual whose first recognized, I emphasize the word recognized, clinical manifestation, appearance was she came in with a stroke. And that's pretty devastating.
Yeah, I've never heard of that, but there are different types of diabetes, aren't there?
Yes, there are. There are two basic types with, a number of variants. Type 1 diabetes is due to a deficiency of insulin. It is the kind of diabetes that we usually associate with kids. It used to be called juvenile onset diabetes, but it can occur in people of any age. The much more common is type 2 diabetes. That accounts for 90 to 95% of diabetes. It used to be called adult onset, but with the epidemic of obesity that we have, and obesity's main cause of diabetes, we're starting to see type 2 diabetes in younger and younger individuals. When I was training 40 years ago, we were starting to see it, in people of college age. Now we're starting to see it in kids in middle school, so-called adult diabetes.
Well,
really scary.
It is, but what on earth would justify that? Are they eating too much sugar, or, at that age?
It is it's the balance between how many calories in and how many calories get burned up. So if people are spending all their time doing on video games, and they're just sitting down and not, going out to play, you don't burn up calories, just by moving your thumbs around.
No.
Or operating a joystick. In fact, you can think about diabetes as a disease that is a result not only of what happens at the individual person level, but also at the community and the society level. Right? So think of all the advertising for food that goes on, particularly food that is tasty, which usually means fat and sugar.
Unfortunately, yes.
And carbs, and how we just drive around and we don't. Our work is mostly sedentary these days. Fewer and fewer people are doing physical labor. And when I was a kid, we always went out to play, and we played baseball in the street, or
stickball or whatever.
There were no video games. Stickball, we played stickball.
Yeah. Listen, tell me, doctor, are there new types of treatments now for diabetes?
Yes, there are a variety of new types of treatments, both for type 1 and type 2. For type 1, it's more in the area of technology, where we have insulin pumps that can give out insulin at specific rates and specific times of day, and ways to measure the blood sugar on a more continuous basis. It's appropriate for some, not appropriate for everybody. That's on the technology side. For the type 2 patients, there are new drugs that have become available, completely different classes of agents that work differently from the kind of drugs that I learned when I was training 40 years ago, and some of these are showing great promise in terms of reducing kidney disease as well as heart attacks.
Well, that's good.
And those are two pretty devastating complications of diabetes.
Well, let's just hope that don't cost an arm and a leg to be able to buy these things. You know what I mean? What I want to ask you is...
They can be very expensive,
yeah.
But, that's one of the reasons why I'm in the VA.
Tell me this.
I don't have to worry so much about cost.
Yeah. You touched before on a fabulous story about the... I think it was the quadriplegic, or I'm not sure, but walked again. Mm-hmm. What are some other historical accomplishments and innovations from VA research?
Sure. So one of the things that as a specialist in endocrinology, the VA has had a couple of people who've won Nobel Prizes. One of them for developing a way of measuring insulin. Mm-hmm. This is absolutely critical. This was critical to understanding the difference between type 1 and type 2. It was not even known that they were different. Mm-hmm. Other things have included VA was early in use of the implantable insulin pump. We've done clinical trials for different drugs. The first successful liver transplant was done in the VA. The development of the nicotine patch, showing that early treatment of high blood pressure could reduce stroke. Mm-hmm. Invention of the implantable cardiac pacemaker. Mm-hmm. I mean, there are people's lives who depend upon these things.
See, this is marvelous. The VA had a bad rap there for a while, and there were some idiots running the thing, but I think it's all cleaned up a lot now. I mean, there are still, there are a few areas that still need to be worked on, apparently, but the majority of it has been fixed up, I think, since this bloke got in. But, I mean, think of the stuff that you do that the public don't know about, that gets out later on, that affects everybody,
It's true. It's an untold story. And listen, I'll be honest. The VA's got its issues. Every system has its issues. Mm. But fortunately, those of us who work in the VA really care about what we do, and we're trying to make things better.
Well, that's fabulous. Well, you do a great job. Now, where can I find more about the VA diabetes research, as well as other medical advances and innovations? Is all this stuff we've talked about,
Sure.
Is it online to be able to read about?
Absolutely. Go to our website, www.research.va.gov, G-O-V.
Okay.
Research.va.gov.
That's pretty simple.
You should be able to find pretty much everything that you want to know, and maybe even more.
Well, you're a great speaker, my friend. You're a former laboratory bench, researcher with current research interests.
I did that for a while.
They're electric, and you've been... and included health services and implementation research related to quality measurement and improvement, and especially diabetes related. Most recently, applications of principles of complex systems. Now, you've authored a book. I wanted to give you a plug on that. Complex Systems in Medicine, a hedgehog's tale of complexity in clinical practice, research, education, and management. What a mouthful that is.
It is a mouthful, but it's actually, I wrote it with the idea that a general reader could read it. And I had people who were not in medicine or even in research or science to read it before it got published.
Okay.
No equations in there, no math.
So where can I buy the thing if I wanted to?
You can find it. It's on Amazon. You probably get it in, could be ordered in any bookstore, but I'm sure it'd be available online. It's published by Springer Publishing.
Springer, right. You know what, Doc? We won't be around, but, maybe one day you could ring up Amazon Prime or type it up and order a new arm and a leg,
You never know.
It's unbelievable.
You never know.
Well, they got everything else. They might as well do that as well. But anyway, listen, wonderful speaking with you, Dr. David Aron.
Thank you.
It's been great. Director, Clinical Program, Research and Education at the Cleveland VA Medical Center. That's the Department of Veteran Affairs. Have a great day, Doc, all right?
Thank you, and thanks to all the veterans out there and those who care about them.
Good idea.
It's been a privilege to serve.
Thank you.
Bye-bye.
Bye-bye now. Dr. David Aron on The Mark Bishop Show.